Chest infection. A chest infection is an infection that affects your lower large airways, bronchi, and your lungs. Pneumonia and bronchitis are the most common chest infections. Bronchitis is usually caused by a viral infection. Pneumonia is usually due to bacterial infection. Pneumonia may be serious and need hospital admission. Before going into the video, we've just printed more copies of what is probably the best plant medicine book ever written, The Lost Book of Herbal Remedies. You'll find 800 plus beneficial plants and remedies in The Lost Book of Herbal Remedies, how to recipes of tinctures, teas, decoctions, essential oils, syrups, salves, poultices, infusions, and many other natural remedies that our grandparents used for centuries. What's also special about this book is that it has between 2 and 4 color pictures for each plant and detailed identification guidelines to make sure you've got the right plant. So get your copy by clicking the first link in our description. Now let's get into today's video. Chest infection symptoms. The main symptoms of chest infection are a chesty cough, breathing difficulties, including shortness of breath and wheezing, chest pain or tightness, high temperature, headache, muscle aches and pains, feeling very tired, a rapid heartbeat. A cold, often called an upper respiratory tract infection, URTI, usually starts with a combination of blocked and/or runny nose and sneezing, sometimes with a mild high temperature, fever. You will usually get a cough, which is often dry and harsh but can also sound like you have a lot of phlegm, sputum, which you may bring up. You may also feel tired and achy, but these symptoms are usually fairly mild and you'll be able to keep going with everyday activities. Chest infections can start with these symptoms too, but you don't need to see a doctor if these are the only symptoms you have. The only exceptions are people with long-term health conditions affecting the lungs, like chronic obstructive pulmonary disease, COPD, and bronchiectasis. People with these conditions are more likely to develop serious complications. Treatment of chest infection. Although most chest infections are mild and improve on their own, some cases can be very serious, even life-threatening. A bout of infection of the large airways, bronchi, in the lungs, acute bronchitis usually gets better on its own within 7 to 10 days without any medicines. If you suspect that you have a severe infection of the lung, pneumonia, you should see a GP. What about antibiotics? Antibiotics are medicines used for infections caused by germs, bacteria, and don't work on viruses. Unless you have a long-term condition affecting your chest, your doctor is unlikely to prescribe antibiotics unless your symptoms and examination suggest you may have pneumonia. What can I do to treat my chest infection? If you have a chest infection, you should have plenty of rest. Drink lots to prevent your body from becoming lacking in fluids, dehydrated, and to help keep the mucus in your lungs thin and easier to cough up. Inhale steam vapor, perhaps with added menthol. This can help to clear the mucus from your chest. Never use hot water for a child's cough, in case they get scalded by accident. Avoid lying flat at night to help keep your chest clear of mucus and make it easier to breathe. Take paracetamol, ibuprofen or aspirin to reduce high temperature and to ease any aches, pains and headaches. Note: children aged less than 16 years should not take aspirin. If you smoke, you should try to stop smoking for good. Bronchitis, chest infections and serious lung diseases are more common in smokers. If your throat is sore from coughing, you can relieve the discomfort with a warm drink of honey and lemon. What about cold and cough medicines? You can buy many cold remedies and cough medicines at pharmacies. There is limited evidence of any benefit from taking cold and cough remedies. What is the outlook? Infection of the large airways, bronchi, in the lungs, acute bronchitis, usually clears without any complications. Occasionally, the infection travels to the lung tissue to cause a serious lung infection, pneumonia. If you have pneumonia and are well enough to be looked after at home, your outlook is very good. If you need to be looked after in hospital, the outlook is still usually good, but not quite as good. The outlook is also not as good for people who also have long-term illnesses such as lung disease, heart failure, or diabetes. When should you see a doctor? Infection of the large airways, bronchi, in the lungs, acute bronchitis, usually gets better by itself, so there is often no need to see a GP. If you have asthma or COPD, you should take your doctor's advice. They may have given you recommendations about increasing your inhaler medication or taking a rescue pack of antibiotics and steroid tablets at the first sign of an infection. If not, speak with them for advice if you develop symptoms of a chest infection. There are a number of symptoms that mean you should see a GP even if you do not have any other lung problems. If your symptoms get worse, you should look out for these warning signs. They include: if a fever, wheezing or headache becomes worse or severe. If you develop fast breathing, shortness of breath, or chest pains. If you cough up blood or if your phlegm becomes dark or rusty colored. If you become drowsy or confused. If a cough lasts for longer than 3 to 4 weeks. If you have repeated bouts of acute bronchitis. If any other symptom develops that you are concerned about. How is a chest infection diagnosed? Your doctor will be able to make a diagnosis of a chest infection by listening to your story and examining you. They will ask about your symptoms and how you are feeling. They may also ask about your medical history and that of your family. They will be interested in whether you smoke, how much, and for how long. The examination may include checking your temperature. Sometimes your doctor will check how much oxygen is circulating around your body. This is done with a small device that sits on the end of your finger. The doctor will listen to your chest, so they may want you to lift or take off your top. If you want a chaperone during the examination, the doctor will arrange one. If you have asthma, they may ask you to check your peak flow measurement. Often no tests are needed if you have infection of the large airways, bronchi, in the lungs, acute bronchitis, and your symptoms are mild. If your symptoms are more severe and you need to go to hospital, then you may need to have the following tests. A chest X-ray may be taken to be sure of the diagnosis and to see how bad the infection is. Blood tests and phlegm, sputum, tests may be taken to find which germ, bacterium, is causing this serious lung infection, pneumonia. This helps to decide which antibiotic medicine is best to use. Sometimes the germ, bacterium, that is causing the pneumonia is resistant to the first antibiotic. A switch to another antibiotic is sometimes needed. How can a chest infection be prevented? There are measures you can take to help prevent chest infection and to stop the spread of it to others. For instance, washing your hands regularly reduces the chance of germs getting into your system. You can pass a chest infection on to others through coughing and sneezing. So if you have a chest infection, it's important to cover your mouth when you cough or sneeze and to wash your hands regularly. You should throw away used tissues immediately. What causes a chest infection? The vast majority of IRTIs are caused by viral infections. Your immune system will fight these off without any help within a few days. Because IRTIs are caused by viruses rather than bacteria, antibiotics won't help in any way. See the separate leaflet called Antibiotics. Sometimes an infection in the upper airways can spread deeper, causing a chest infection. Sometimes germs, bacteria, already living in your lungs can multiply, with the same result. There are two main types of chest infection: acute bronchitis and pneumonia. Acute bronchitis. Bronchitis is inflammation due to infection of the bronchi. Itis is the medical term for inflammation. It can be acute or chronic. Acute means lasting a short time and chronic means lasting a long time. Acute bronchitis is common and is often due to a viral infection. Infection with a germ, bacterium, is a less common cause. See the separate leaflet called Acute Bronchitis for more details. Pneumonia. This is usually a bacterial infection of the lung and may be serious. Treatment with antibiotics is usually needed. See the separate leaflet called Pneumonia for more details. Who gets chest infections? Chest infections are very common, especially during autumn and winter. They often occur after a cold or flu. Anyone can get a chest infection, but they are more common in young children and the elderly. People who smoke. Pregnant women. People with long-term chest problems such as asthma, COPD, cystic fibrosis, heart disease, diabetes, kidney disease, or liver disease. People with an immune system that's weakened either by conditions such as some cancers, including lymphoma, myeloma, and leukemia or AIDS, or by treatments such as high-dose steroids, chemotherapy, or other medicines that can suppress your immune system. And don't forget to check out the Lost Book of Herbal Remedies book, where you'll find 800 plus beneficial plants and remedies on how to recipes of tinctures, teas, decoctions, essential oils, syrups, salves, poultices, infusions, and many other natural remedies that our grandparents used for centuries. What's also special about this book is that it has between 2 and 4 color pictures for each plant and detailed identification guidelines to make sure you've got the right plant. So get your copy by clicking the first link in our description.